you take it when you don't need it, it damages your brain. When you take it when you have ADHD, it's okay, you know. It is addictive. Very much so.
Addiction doctors tell us this situation is getting out of control.
So the whole deal with prescription drugs is that, people are pretty disillusioned around the use of them because they think, it's medically sanctioned, it's okay to use. And it's not, unless it's for those who it's prescribed to, because it's monitored by a doctor, it's the right dosage for that person.
Well, I have what's called inattentive type ADHD, which is essentially the exact same thing as ADD, and I've experienced focus and attention problems my entire life. I was prescribed a very small dose of Concerta, which is a relatively mild stimulant. It's not so much that it just sort of makes you focus, but it really clears your mind a lot. In class, I would often sort of like drift off. I wouldn't be able to like process what I was looking at or what I was reading because there was just too much going on in my head. But it gives you the ability to sort of sit down and look at something and really, really process it if that's not something you could do before.
Gnarly, radical, on the block I'm magical. See me at your college campus, baggy full of Adderalls. Call me if you need a fix, call me if you need a...
People will take it one Adderall before they even do their homework, because there are a lot of kids here who are actually prescribed those kinds of drugs, and they're pretty relaxed about giving it out to their friends. So a lot of kids will just take one for a test or take one for a long night of studying. If someone's really stressed out about a test, someone's like, oh, it's fine, just you can have one of my Adderall, or you can take one of these. Okay, great, I'll be fine. And it's kind of upsetting to watch.
Yeah.
Because it's also sad for the kids that actually really need it. They just watch all the other kids take it as a drug, and that's...
Up all night on Adderall, innocent, but not at all. She my Brooklyn Barbie doll.
Kids who will surprise you too, who aren't your real users, and they'll be caught or they'll admit to doing it.
They won't use Molly, cocaine, anything like that, because they think it's drugs are really bad, but they have no problem using Adderall or Ritalin because they don't, in their mind, it's not an illegal drug because it's prescribed to someone, and they don't really see how that can badly affect them.
Because you will talk to any college kid, and everyone's pulled all-nighters where you have to get stuff done, or it's before a final or before a midterm. And whatever happened to coffee. Or you just stay up and you just jam out, but using something that's not prescribed to you, it's never going to be the right thing to do. It's never going to be the healthiest scenario.
I don't think prescriptions are that hard to get. If you say you have trouble paying attention, if you go see a doctor, I think they will give you one more so than they wouldn't give you one.
Most people could easily find several people who would sell them prescription medication. I even know of at least one person who had prescriptions filled out by multiple doctors. So they had more than they could ever use, basically.
Well, yeah, that's illegal drug use, right? Sale and consumption of. Pretty lucrative, though. It's a very hard thing to dissuade people from, because you can make some good money doing it, and kids have done it here. So I think that and pills too are so easy to move. It's not like it smells. There's no odor to it. It's easy to pass. You can also ditch it and hide it very easily from people. So I think that there are a lot of pros for people who want to make money, right? Because think about people who do stuff like that. It's about serving themselves. They're not out there to help others, right? It's about making money for themselves and really not caring how it's going to affect somebody else. Very, very rarely do you hear somebody who's dealing say, yeah, and be careful how much you take. They're not really in the job of telling you what to do with it once they sold it. They just want your money. So I think that it's very self-serving for those selling, and I don't think that by any stretch of the imagination they have other people's best interest at heart. wow, this is going to really help them study. They're just thinking that this is going to make me money.
It is illegal. When you get your prescription, you have to sign a contract saying, this is for me. You can't get refills on the prescription because like they don't want you to sell them and then come ask for more. So you do have to sort of, you do promise them that this is for yourself and not for, monetary gain. It's just kind of a silly idea. There's a lot of really negative side effects that could come out of it. I've just had this huge meeting with the doctor where he was basically giving me all these reasons that I should not give it to other people because it's been known to sort of stunt creativity in people that don't have ADHD and are taking it. And it gives you kind of the capacity to work like a robot, but it kind of takes away any sort of creative spark that you had.
So when you are diagnosed with ADHD and you're given this medication, which is actually, like speed or something, because you're in this excitable, it actually lowers that for those people and makes them stay and pay attention better. When you don't have ADHD and you take that medication, it accelerates that. So it gives you an upper feeling or a feeling that that's why people will abuse it, and then it keeps you awake, and it's not healthy for you.
A couple girls had taken Adderall and it was a time release. So meaning like it didn't, take into the bloodstream right away. There was like a time release on it. And by the time it kicked in, they were so loopy. They were totally whacked. There were 3 of them. And the way it affected them was different for all of them, but they, had driven to school and they were seemingly fine. And then they were totally out of it at school. And then when I had to talk to them, because I was the drug and alcohol person there, they were like, yeah, we'd never tried it before and we had no idea that it would have this effect. And for them, they didn't have kind of that adrenaline piece to it. It was more like they were kind of out of it. So I think that's another part of it where you just don't know how it's going to affect you.
And it does really good things when you need it for a lot of people.
So it's kind of calmed me down a lot, and whether that's for better or worse, I think the majority of the time that's for the better, especially in a school setting where, you're supposed to be studious, you're supposed to be, not raising a ruckus. I've actually never been happier. It is very, saying life-changing is pretty radical, but it's very, it's extremely, extremely, extremely helpful to not have to, sit at my desk for 4 hours to do a homework assignment that should take me 45 minutes. Makes a big difference.